Hello viewers, welcome to our FP Live session. Today we have with us Dr. Jayalakshmi TK, Consultant Pulmonology at Apollo Hospitals, Navi, Mumbai.
Hello viewers.
So recently, Maharashtra state government has lifted all the COVID-19 restrictions. So the pandemic is over now. So we'll discuss regarding the same with Dr. Jayalakshmi. So doctor, my first question is, what is the COVID-19 new variant?
So we can't say it's a new variant because it's been going on in India since January when we had our third wave. So this is the B82 variant. So the COVID BA1 variant, which is the Omicron variant, and the B82 variant, which is another derivative of the BA1 itself, but it was also called as stealth variant because it was more harder to detect on the tests, and also it used to spread much faster. So if Omicron spreads almost 10 times faster than the Delta variant, the BA2 variant of Omicron will spread about 10 times faster than the BA1. Although the severity of the Omicron variant, both BA1 and BA2, is much less as compared to the Delta variant or even the Alpha variant. So this is the variant which we are talking about, the BA2 variant.
Doctor, is BA 2.0 is the driver of the new wave?
Yeah, so in India, when the third wave had started, initially the BA1 variant had started to increase. Towards the end of the wave, 75% of the cases, even up to 80% of the cases in some states were BA2 and not BA1. And about less than 5% was Delta. So BA2 had already overcome BA1 and had driven the entire surge of cases in the third wave. The significant thing in the third wave was that there was a huge number of infections. There were a large number of people who were infected. Many of them did not get tested. Many of them underwent treatment only at home or only had mild symptoms and did not need much treatment. And the hospitalization rates and the death rates were very, very low. Similar was the trend seen in South Africa. In UK and Europe and currently in US, in UK particularly, there has been a continuous increase in the cases, and also we are seeing that in much of Europe. This is being driven by the BA2 variant, which they had not been infected with earlier. So, even though they have a highly vaccinated population, they are still seeing very high numbers of infection. As on date, there is 1 in 15 of UK citizens are infected with the BA2 variant. So that's a very high infection rate. And the numbers are the highest since the pandemic began. But it is not seen in the number of hospitalizations, neither the deaths have increased. And also the pandemic restrictions are not on in the UK currently. There is no mask mandate. So that is the situation there. So what we can see is that BA2 definitely drives the pandemic wave as of now, and but the severity and the number of deaths is much less. Similar is the case which is seen in China. They are now suddenly struck with the Omicron variant, but the situation there is a little different because they have not had any number of serious infections in the last 2 years because their policy of containment was working so well, but it is not working well against the Omicron, which, as we know, spreads much more faster than the Delta variant.
Doctor, what about the Delta variant?
So this is an interesting name which is coined as a combination between Delta and the Omicron variant. It is seen in a very small proportion of patients, maybe in France and some one or two other countries, and it is not really a driver of the pandemic. It is not it is not a major concern as of now.
Doctor, should I wear a mask?
So the question today, Maharashtra government has taken off all the mask mandate, all the mask restrictions. So it's not mandatory to wear the mask. However, it is optional on part of citizens. And definitely in a hospital environment, if you're working in any high risk environment or if you're traveling in a crowd, it is always better and safer to wear the mask because COVID has not yet come to zero levels. So there are still cases on and off. And the issue with Omicron is that reinfections are known. Although Omicron gives a very good natural immunity, especially the BA2 variant gives a very good natural immunity, and once you get it, you are probably having a good immunity. But still, there is a higher chance of reinfection with Omicron than with Delta or Alpha. So there is a chance that you may again get the illness, and hence it is always better to wear a mask, especially when you're in a crowded area, when you're traveling, when you're in a hospital setting, when you're in a flight, when you're in an airport. So in all these situations, it is definitely better to wear a mask.
Doctor, my next question is, there is a need of booster dose.
So the booster dose has already been rolled out, third booster dose in India for healthcare professionals, for vulnerable populations, that is the elderly, those with comorbidities, with diabetes, with immunosuppressions, cancer patients on chemotherapy. So all these high risk population definitely should take the booster dose. Now, when it comes to normal population, that is the normal healthy population who has already taken 2 doses, if they've already got Omicron, documented Omicron in the Jan and Feb, the immunity will still be there because Omicron is itself works like a natural vaccine and does give a very good immunity. So it's an option for them whether they should take the booster or not. Taking the booster will definitely increase the immunity level. Booster doses across the populations has shown to increase the chances of getting a milder infection or getting a preventing hospitalization, preventing deaths. These are definitely seen effects of COVID vaccination. But in the context of Omicron and in the context of like we see in Africa, they've had a very less vaccine coverage. They have hardly 11 to 15% of vaccine coverage, but they've been extensively infected. First wave, second wave, again with Omicron, and hence there is a natural immunity level is very high. In view of that, their number of cases, number of hospitalizations, number of deaths is very, very less. Although they have not really been getting the booster doses or even the first and second vaccination doses. So the natural immunity offered by Omicron is really very high. So people who have had Omicron recently can afford to wait for some time, and the others can go for the booster doses.
So, doctor, and there is some increased cases in US, UK, and China. So, the India will face a new wave soon.
So, as we said, the increased cases in US, UK, and China are being driven predominantly by the B82 variant. That is the stealth version of the Omicron variant. So, in India, in January, the studies, seroprevalence studies which have been done, have shown that there is about 70 to 80% of the cases have been of BA2. So, it is probable that we already have a good immunity to BA2 because of this Omicron wave which was there, where a huge number of population has been exposed to the infection and has acquired natural immunity. So it is possible that we may not get another wave because of BA2 in the near future, but any other variant, new variant coming up and giving a new wave cannot be ruled out.
So, doctor, can you please summarize for us what precautions we need to take and all?
So I would say that one of the main things or the take home which we have to take from this pandemic is that we need to be much more careful about our health. We need to have regular sleeping hours, regular working hours, regular exercise. We need to pay attention to our diet. We need to take supplements when necessary. We need to get our regular checkups. Especially, I would say, for the people who have already got COVID in either the first wave, second wave, or the third wave, they should get a regular checkup to see whether any disease has been triggered. Like we know that there are cases of diabetes being triggered, asthma being triggered, high blood pressure getting triggered, or starting off after having got Omicron. So it's good to have a general health checkup and to make sure that your health is okay and to strive to maintain it. It is optional to wear mask, but it is definitely healthier to wear it in any case of in any high risk or crowded setting. I would suggest definitely vaccination should be taken by the high risk population, by the general population if they have not been exposed or not been infected with Omicron, and and to take better care of our health. So that is, I think, the take home from the pandemic.
Thank you so much, Doctor.
Thank you.